I'm Thomas Baldrick. Happy to have with us Alison Witkin from Massachusetts General Hospital. Thanks for stopping by at ATS.
Thanks for having me.
Let's talk about the poster you have on patients undergoing arthroscopic knee surgery and their risk of PE. How did you come about studying this?
Yeah, so as a fellow at Mass General, I've been involved in the pulmonary embolism response team where we do consults on patients who have massive and submassive pulmonary emboli. And my first consult ever was on a young woman, no medical problems, who had, an elective meniscal repair, was sent home the same day, never on crutches, who presented with a massive PE, almost ended up dying from it, required systemic lysis. And then maybe 2 weeks later, saw another very similar case. And so that sort of surprised me. It wasn't something that I had previously thought of as a major risk factor for pulmonary embolism. And I started looking through the literature, looking to see if there are other cases, what the evidence is for or against DVT prophylaxis, and was really surprised at how little information there was.
So what's significant about what you have found?
Yeah, so what we found is that, while the overall risk of DVT after arthroscopic or other non-major knee surgeries, so not knee replacement surgeries, varies from study to study. It's up to about 10%. Most of those studies don't really talk much about pulmonary emboli. They report that if there were any, they were very small, not significant. There's a couple case reports, but this is actually the largest case series. It's 9 patients of large PE after essentially a relatively small surgical procedure.
So what can be done to help these patients?
So I think what can be done is twofold. One is education and making sure people realize that these knee surgeries, while they are considered a relatively low risk procedure, do carry the risk of DVT, and that DVT can lead to life-threatening PE. And I think the other thing this focuses on is the need for more investigation. We just have a case series. I can't say from this that every patient who undergoes arthroscopic knee surgery should be put on pharmacologic DVT prophylaxis, but I think we need better and higher quality studies that exist.
So what might you be doing next?
So next I hope to this is a selected group of patients. These were only patients who were activated from the pulmonary embolism response team. I hope to do a larger, using ICD-9 codes, and look through the database and try to figure out how common this actually is. Is it something that's just being underreported, or are these 9 patients just outliers?
Very good. Thank you, Alison. Appreciate your time.
Thank you.